If you've ever dealt with that nagging, chronic neck or back pain, you know just how draining it can be to find anything that actually works. Well, today, we're going to demystify a really specific, non-surgical path that's providing real, long-term relief for a certain type of pain.
So here's the roadmap for our journey today. First, we'll figure out what kind of pain we're even talking about. Then we'll hunt down the culprit. Are your joints responsible? We'll look at the first diagnostic test, the MBB, and then talk about why we have to confirm it twice. After that, we get to the good part, turning off the pain. And finally, what does life look like after the procedure?
All right, first things first. It is absolutely crucial to understand that not all back pain is created equal. The procedures we're breaking down today are laser-focused on a very particular kind of discomfort.
Okay, so here's the big difference we need to talk about. Axial pain versus radiating pain. We are talking 100% about axial pain. That's the kind that stays put, It's right there in your neck or in one spot in your back. It doesn't travel. Now, if you've got that shooting pain that goes down your arm or leg, what a lot of people call sciatica, that's radiating pain. And it's super important to note these procedures are not designed to treat that.
So, if we're dealing with this localized axial pain, what's actually causing it? Well, the answer often hides in these tiny but incredibly important joints that run all the way up and down your spine. Let me introduce you to the facet joints. You've got a pair of them at every level of your spine, from your neck down to your lower back. They're the things that let you bend and twist. But here's the catch. Just like the joints in your fingers or your knees, they can get arthritis. They can become inflamed and, you guessed it, really painful.
So does any of this sound familiar? Do you wake up and your neck or back is just incredibly stiff? Does it hurt more when you stand up straight, but feels a little better if you lean forward, say over a shopping cart? Maybe it's a pain to turn your head to check your blind spot while driving. These are all classic telltale signs that your facet joints might just be the problem.
Okay, so your doctor might suspect it's the facet joints, but in medicine, suspecting isn't good enough. You have to prove it. And that brings us to this really clever first step, a procedure that's purely a test, not a treatment. This is called a medial branch block, or MBB. And what's so cool about it is its mission. The whole point isn't to fix the pain long term. Nope. It's just to see what happens if we can shut off the pain signals from a specific joint for a little while. So the doctor injects a numbing medicine, like lidocaine, right onto these tiny little sensory nerves that act like telephone wires from the joint to your brain.
And this whole thing is incredibly precise. They use an X-ray to guide the needle to the exact spot. A little bit of that numbing medicine goes in, and you'll start to feel the effects within minutes. But remember, this is all by design. The relief is only supposed to last for a few hours.
And this quote just nails it. The whole point is to go test drive your back. You're not supposed to go home and lie on the couch. You're supposed to do the things that normally hurt. Do the dishes, go for a walk, bend over to tie your shoes. The big question is, during this short window of time, is that familiar pain gone?
And we're not just looking for a little bit of improvement here. For this test to be a win, doctors are looking for 80 to 100% of your typical pain to be gone. It has to be a dramatic, obvious difference, because that's how we know we've truly found the source of the problem.
So, let's say the test is a huge success. The pain is gone. You'd think, great, let's move on to the treatment, right? Well, not so fast. Believe it or not, one successful test isn't enough.
And that's a perfectly fair question. I mean, if we found the spot and the pain went away, why on earth would we do the whole thing all over again? Well, the answer is all about making absolutely sure we're right.
The main reason is to rule out something called a false positive. You see, sometimes the brain is so powerful that just the act of getting an injection can make you feel better. That's the placebo effect. By doing the exact same test on a different day, we can confirm that the relief was real, that it was because we numbed the right spot, and that it wasn't just a fluke.
So the rule is you need 2 successful tests, both showing that incredible 80 to 100% relief. Once you get that second yes, then everybody, you, your doctor, can move forward with total confidence to the procedure that's designed to give you that long-term relief.
All right, so we've done our homework. We've identified the pain source and we've confirmed it twice. Now we get to talk about the main event, the actual treatment that can provide relief for months, or in some cases, even years.
This procedure is called Radiofrequency Ablation, or RFA. And instead of just temporarily numbing those little nerves, RFA uses a special kind of needle to create heat. This heat makes a tiny lesion on the nerve, which basically disrupts its ability to send pain signals. Think of it like this. The MBB was just putting the noisy alarm on mute for a few hours. The RFA is like disconnecting the wire to that faulty alarm.
So how hot are we talking? Well, that specialized needle heats a tiny, precise area to between 80 and 90 degrees Celsius. That's around 175 to 195 degrees Fahrenheit. It only lasts for about a minute to a minute and a half, but it's just hot enough to stun the nerve and stop it from sending those pain signals.
Now here's something that might surprise you. Even though we ablate or disrupt the nerve, it's not actually permanent. Our bodies are amazing healers, and over a long period of time, those little nerve fibers will slowly but surely grow back.
Which brings us, of course, to our final chapter. What happens after the RFA procedure is done? What's the recovery like, and what kind of results can you really expect?
So one of the most important things to know is that relief is usually not instantaneous. You'll probably have some soreness from the procedure itself for about a week, but then over the next 2 to 4 weeks, you should start to feel that deep underlying pain begin to fade. By about the 6-week mark, you're typically feeling the full, fantastic effect of the procedure.
And the big question, how long does this last? Well, on average, most people get somewhere between 8 and 12 months of significant pain relief. But for some lucky people, that relief can last up to 2 years, and sometimes even longer.
So let's just boil it all down. The key thing to remember is that the relief is long-term, but it's not forever, because those nerves do grow back. But the great news is the whole procedure is repeatable, and for the right person, this can be an absolute game changer, giving you back your ability to function and just enjoy your life again, all without surgery.
We've really taken a deep dive into the what, the why, and the how of this whole process. So if your pain story sounds anything like the one we've told today, maybe the next step is just having a conversation. Could asking about your facet joints be the start of your next chapter?